Did you know that making the wrong Medicare decision can completely wipe out your retirement savings? The thing is, in America, the number one cause of bankruptcy is medical bills. So in this video, I want to cover what are those mistakes that can happen that can, one, result in really bad health insurance, and two, taking out your entire savings, and what can you do about it? I'm Emily with the Medicare Coach, an independent Medicare consultant helping individuals easily navigate Medicare, both the rules and the insurance company options to do what's right and best for you. I began my career working in investment banking, helping the bank manage both their clients and their money's financial risk, and I realized that Medicare was a really big hole in everyone's retirement plan. So let's talk about what is Medicare and how can you avoid those costly mistakes to protect your retirement savings. So I'm also going to share some extra bonus resources down below to help you easily navigate your Medicare decision as well. So, what are these 3 common mistakes that people are making that can easily jeopardize your retirement savings? The first one is that the provider that you want to see does not take Medicare. I got an email a couple of years ago from a woman, and she was asking for some advice. Her father had been diagnosed with cancer, and they wanted to go to MD Anderson for a second opinion on his cancer diagnosis. But the thing is, the Medicare plan that he selected would not cover MD Anderson, and the plan that MD Anderson would accept, he could not get because of his pre-existing conditions. So, when it comes to Medicare, he had to decide. Does he just stay with his in-network provider that's not preferred, but he could do it? Or does he use his retirement savings and pay for MD Anderson? It's not a good option. But the thing is, if you go into Medicare correctly and you think about how providers work, you can see the best doctors in most cases. But we have to take a very long-term view of Medicare when you first join, because again, rules don't let you just change whatever you want. So again, wanting to see a provider that does not take your Medicare coverage can lead to big costs. I had another woman who did not realize that her doctor did not take her Medicare, and she got a $45,000 bill. Not great, right? And can easily wipe out a retirement savings. So be thoughtful around providers when it comes to Medicare. The more that you know, the more that you can protect yourselves. Number 2, again, not having the right coverage can also be an issue. People come to Medicare and they say, well, I'm only gonna have Medicare A and B, I'll get the rest later. But the thing is, if you only have Medicare A and B, Medicare Part B, which covers most of our medical bills, it will only cover 80% of that cost. And so you have a big financial liability if we don't have full coverage when it comes to Medicare. So I recommend that you don't just check a box and sign up for Medicare. I recommend that you do it thoroughly, thoughtfully to have that best healthcare to, again, avoid those big mistakes in the future. I've seen people who pay a lot for certain employer plans or for, say, Cobra or other private plans, and they think that they're covered, and then they get a $100,000 bill because it did not meet Medicare rules. And so while it's important to have health insurance, because of how Medicare insurance rules work in our country, you have to have the right coverage in order to be fully covered. Just because you're paying $1,000 a month for a health insurance plan does not mean that you're actually covered. So be thoughtful and get the right coverage that you need, ideally when you turn 65. Okay? The third thing I see people make is that you don't have coverage at all. And if we don't have creditable coverage once you're 65 and over, you can have very large penalties, and you can also have unpaid bills. So people will say, I hear this a lot with business owners, well, I have a plan, I'm good. Well, your plan doesn't meet Medicare rules. So now you don't have Medicare A or Medicare Part B, so we're having penalties now. And also, we can't get you into another Medicare plan until February of the upcoming year. So you're gonna have 6 months of no health insurance coverage. So Medicare is not as simple as the insurance companies make it out to be. When my dad and I went through this, we kind of just assumed you just pick out a plan and you're done. And that's not the whole story. There's more to Medicare when it comes to government rules, the options, coordination of benefits, all of those things. So please be thoughtful and thorough when it comes to Medicare. Medicare can be great, but you need to understand how it works and know what's best for you. And by doing it right when you first join Medicare, It just makes everything better in the long run. Better healthcare, again, protecting yourself financially, all of those things. So please be thoughtful when it comes to Medicare. And please let me know what questions you have in the comment section below. Here's to helping you easily make your right Medicare decision.